met you, my name's Kendi Elmore. I'm the founder of the Lobby Medical Sales Network. And, as a longtime rep myself, my vision behind the Lobby is really creating a central space for everybody in the medical sales industry to come together, right? Whether it's through our networking events we have in over 30 cities now across the US, whether it's through connecting virtually on webinars or in the Lobby platform. We've got job boards now. We've got, tons of resources, coaches, and programs really built to be a place where you as a medical sales rep or aspiring medical sales rep or longtime manager, whatever it may be, if you're looking for resources, that's really what we go out and do. We identify those companies, those resources, those opportunities, and help you get connected with them. And so today I'm super proud and honored to have Brandon Edward here from RepPrep.ai to share an amazing platform. When I first saw it, I was 10 years orthopedics myself. My first thought was, God, I wish I would have had this as a rep. So excited to share it with you guys so you guys can see this technology, demoed live, answer any or ask any questions you have for these guys, and really learn about this technology. We all hear about AI and the impact it's making in so many different places in our lives. So I think it's incredible you guys have brought it to our space. So guys, thank you so much for being here, and excited to kind of share the platform with the community today.
Awesome. Kendi, thank you so much for that intro. Really appreciate it. It's been an absolute pleasure to work and meet you. To hop right in, my name is Brandon Hoover. I have been a med rep for the past 10 years. Eddie and we are both co-founders of RepPrep, and we have very similar background. But what we noticed over the years is that there was not much helping us prepare for our sales calls. There was not much out there that helped us close deals. And that's why we took the initiative to create RepPrep, to provide reps not only with all the information that you can ever need to go and have an informed discussion with a physician, but to also cater you and standardize how we sell and the quality of the call to be able to raise the bar, to not just show up and have the same elevator pitch every time and to kind of throw and see what sticks out there, but to go in and have these really incredible in-depth conversations with these doctors, whether you have experience in the field for 20 years or if you're a brand new rep. There's information here that will really assist you. It's mobile friendly. You could use it on the go. The way that we thought about this is if you see a doctor after you're finishing up a case, a new target that's scrubbing his hands at the sink, we want to be able to have a tool that you could pull up in real time and know everything you need to know about that doctor. And so without further ado, we're going to share our screen. We're first going to show a sales plan of ours. This is all the information that you're going to be expected to get on every single NPI in the United States. Then we'll go and show you our territory map and how to identify new targets and generate new plans. So I'll be monitoring the chat if anybody has specific divisions they want us to focus on. This works for all device, pharma, diagnostics, anybody that has an NPI. We're soon going to be rolling out our GPO and hospital and clinic information as well, so you can generate plans on them as well. But without further ado, I'll pass this over to Eddie. He's going to review the sales plan, then I'll hop in with the territory mapping after. Thank you.
Awesome. Thank you, Brandon. It's great to meet you guys. Kendi, thank you so much. So we'll get right into it. So we always start off with a report, just so you guys have an idea of, this is truly our bread and butter, the report aspect of this. So we want to give you an idea of everything that we're reporting out on it. So the first thing you'll see, so I pulled this report today, so you can adjust the sales status, and this feeds into our mini in the field CRM that we have. So you can adjust it to wherever you are. Let's do negotiate pricing. The cool thing about our software, so I know myself, I sold probably 6 different products at once, right? And so our software is actually going to tell you what's the best product to lead with for this physician based on the data that we're finding. And our goal with that was to take away the first, 2 to 3 minutes of probing questions that, frankly, make you sound like every other rep, right? What's your volume like? What types of procedures are you doing? And instead, you're going in there and you have a purpose, right? You have a focused sales call. And we take it a step further. We give you an explanation of the chosen product. So we're going to explain why the software chose the product and why you should lead with it. So first half of the report is very data heavy. We're going to give you contact information. We'll send you the email address as well if we can find it. Then we're going to have any website that the physician is mentioned on. Then we go into licenses, credentials, certifications, any affiliations, and then notable colleagues. So this section right here is one of my favorite sections of the report because as Brandon alluded to earlier, right, what we're trying to get reps to do is get out of that like robotic elevator pitch experience that they give these physicians, right? Instead of going in there and just regurgitating information that's on your literature, why don't we customize this entire sales call to fit the needs of the physician? So these PubMed articles, we have an integration with PubMed and Google Scholar, and we're reporting out on any article that the physician was an author in or a part of, but also any article that helps sell the product that we chose. So this product that we chose was the Stryker Triathlon Knee right here, right? So these PubMed articles that we're pulling, they're all about total knee arthroplasties, and this physician who we're pulling it for is involved in all of them. So this is like, I can think of like no better warm introduction, especially if you never talked to a doctor. It's like, hey doc, I read your paper on recurrent effusion following total knee arthroplasty. I have some products that closely relate to your research. I'd love to talk to you about it for a couple of minutes, right? Just shows that you've taken the time to do some research, read their article, and it helps you separate yourself from the crowd. We take it one step further, we summarize it for you, and we give you a link to the article. So next we have awards, honors, boards, membership, society. If you ever pull a report and you see not specified, all that means is that we couldn't verify the data from two separate accredited sources. So that's our checks and balances system. We want to make sure that everything we're putting on these reports is true, right? So I'd rather have not specified than false data. And so that's a way that we again, just make sure that data is correct. So in this section, we're going to go over research interests of this physician. It's based off, again, Google Scholar and PubMed. And then we have Medicare claims data. So this is great to get an idea of what your physician's volumes are, what they're billing for. So for example, we got total hip and knee right here. You got the volume, and then you have the average Medicare payout amount. Next, we have Sunshine Act data. So obviously, Synthes is targeting them. This is also a Synthes distributor right here. Just gives you an idea of what companies are buying them lunch and who your competition might be. Then we go into patient profile. So age group, common conditions, demographics, procedures. It's all good information to have. This part of the report, this is where we really focus on your product. So what we're going to do is a product market analysis. So we'll do volume and market trends. And then we're going to dissect your product, right? We're going to pull you away from that literature, and we're going to really help you like break down exactly what you're selling. So we're going to give you the strength and weaknesses, detailed advantages and selling points, unique selling points, and then what's giving you the competitive edge. Now, this information is being cross-referenced against the top 3 competitors in your territory. So in this specific territory, Zimmer Biomet, Synthes, and Smith & Nephew are your top 3 competitors specifically for this physician. So what we're doing is we're taking Medicare claims data, so the CPT codes that refer to these products. Most companies that have FDA approval are going to have CPT codes for their products. We're going to see what physicians are billing the most in that territory, and then we're going to report out what is billed for the most. So in this territory, Zimmer Biomet, Synthes, Smith & Nephew. And that's kind of how we get that information. Then we're going to give you advantages compared to your competitors. So what's going to give you the competitive advantage against these 3 companies? And then we'll kind of break down the market share data. So does anyone have any questions right now?
You can put them in the chat. I'll be monitoring. I'll stop you if there's any questions, Eddie.
Okay, awesome. All right, so now we get into the sales plan aspect, right? We're focused on helping you close these physicians. So this is where we kind of break down the talking points. So like, what can I go in there with? What's going to be like my first topic of conversation? Then we have this objection section. Now, this is really cool. So what we're doing is we're turning this into an interactive chatbot. So you're actually going to be able to interact with an AI version of this physician. You can practice cold calling. You can ask it more probing questions, anything that you can think of. And so that's something, it's about 3 to 4 months in our pipeline. And so if you look at some of these objections, like this is a very reasonable objection this physician may have, especially when it comes to press fit or cemented stems, right? So if you read these, I mean, the responses. Sorry, what was that? Oh,
I think it was just feedback.
okay. So the next thing, so we have 5 preloaded sales methodologies that you can select before you pull a report. So we chose the challenger sales. So for trademark reasons, we renamed them to consultative. So this is where it really breaks down that sales plan. So I know that most companies, they, especially when you're in training, right, they'll push a specific type of selling, and it also depends on your personality. And so we have 5 major sales methodologies that are preloaded in. One of which is the feature, benefit, and value. So one of our biggest clients is the medical sales college. They asked us to add that in. And so let's say, you bring this to your company. If there's something that they teach that we might not have, we could add it in within 24 hours. So this is great, right? I mean, especially we see this with a lot of orthopedic reps as well. They get caught in this habit of covering cases. They're not actively selling as much as like a diagnostic or pharmaceutical rep. And so, like anything, right? If you don't practice it, you could lose it. And so just having this breakdown of the actual sales call is just amazing, right? It takes away that stress and anxiety of like, oh, what's the first thing I'm going to say? How am I going to set up the sales call? And you can customize this however you want. Then it ends with a call to action. So you can save these sales plans, you can email them, you can even lead us feedback, and we take the feedback very seriously. So if you loved it, say great, we'll get a little notification. Or if you have, negative feedback, we love that too. So let us know, and then we'll take action to fix it.
Awesome. Thanks, Eddie. I'm getting up to date with the chat right now. I just responded to Ray for the SWOT analysis, where we're getting that data from, and then the competitor data. Also, as Eddie brought up, we can justify and select from any sales methodology that you prefer. So challenger sale, spin selling, integrity selling, feature, benefit, value. We could add that to have it be customized in the talk track as well. And then Peter, for your question, is intended to be connected to a CRM. This could be a standalone feature as well. We could live alongside a CRM, or we could do a full integration with Salesforce. We are up to date with the highest security credentials. We'd love for you to talk with our CTO as well, who could speak further on that. But we are fully credentialed for it and have the highest security clearance. As far as that goes, we do have some minor CRM features as well. That for small companies, it's great. You can still track and monitor the pipeline. We'll go into this after the demo. Does anybody have any questions right now regarding the data on the report before we hop into territory mapping?
Or anything you want me to go back to?
All right, well, we'll pull another report in real time as well so you guys can see. But next, I want to show you how to identify new targets. So there's 2 different ways that we can find new targets here with RepPrep. The first way is with our Elasticsearch, our territory mapping. So you could search by any city, state, zip, county, or zip code, or multiple states. And it will pull up every single doctor and every NPI that's in that area. You could go the step further by selecting every specific specialty that you'd like to search for and target. And then you could even go the step further and search by CPT code. So 20610, that's injection at a knee joint. You can go and search all the specific orthopedic doctors that bill out for that specific CPT code, and it will highlight those doctors there. Once you click them, you'll be able to see how many procedures that they did in the previous year, as well as their total claims. You could save those doctors, and then they will actually populate in your My Doctors section, or you could generate a sales plan with just one click from there. But if you go into the My Doctors tab, you'll see a couple things. This is intended for teams, for management, but we also have a direct-to-consumer if you just want your individual account. But your managers can prioritize share doctors with the team. You could even go and edit any doctor that you've saved, and you could add notes. So there's surgical preferences. So they're in one place instead of sharing your notes on your phone with your associate reps. You could put their coffee order. You could update their cell phone information, and it could be closed loop to your team. So additional information that you pull will only be seen by you guys. You could also go into the sales plan tab for any sales plan that you end up pulling, and you can change the sales status of them like I talked about in a brief CRM. So planning, follow up, did you win the deal? Did you lose the deal? We're going to be making this a lot more robust as well. But the first major clients that we're working with, they just want us to integrate with their Salesforce. But for smaller companies that want to save money, because we are very budget friendly as well, we're a fifth of the cost of Acuity MD and more than a tenth of the cost of definitive healthcare. And so adding the CRM feature saves them a ton of money. So the second way to find out like if you wanted to pull all your targets in a given area all at once, you could put in your territory. So we'll just do a zip code. You could do Orange County yeah. So Orange County, California. Say we're calling on all the orthopedic guys. Select all the orthopedic specialties that you guys focus on. And then it will populate every single doctor that's in that specialty in your territory. You could select them all and just save all of them at once. If you find a doctor that you like, you could just save them individually that you want to prioritize. Save them, and then you can go ahead and generate your sales plan. So when generating a plan, it's very simple. You'll already have your products preloaded. In the Teams version, we typically have the marketing team input their products to ensure if there's any red tape, they can customize how strict they want the sales plans to be. They could customize exactly how they want the talk track, or if they're flexible, it could be fluid. A cool thing about this is when you're setting up your account, you actually put your communication style and your assertiveness level in. And so it can actually respond and generate your talk tracks and how in a way that you would actually be presenting it. I remember I was just messing around with it one time and I just put Surfer Dude in there and it was like, hey bro, check out our new implant. And it was pretty cool. So it's fully customizable in that way. And so Eddie just generated a plan with one of the doctors we found. And what it's doing right now, it's scouring through the entire internet and scraping for any information that it could find. It's cross-referencing it and putting into one system that's feeding into our large language model, Cutting Edge, to generate the report. We also have 26 different APIs set up with MPI registry and CMS.gov and Sunshine Act information, PubMed, Google Scholar, to ensure that all this information is accurate, up to date. Our MPI registry is updated every 2 hours. So if a doctor moved 2 hours ago and filled out the paperwork to change the practice, it will be on there. So I'll be monitoring the chat real quick to see if there's any additional questions. And if I wasn't able to answer one of your guys' questions already fully, please let me know. So you could see here with the report that we just pulled, it takes about 30 seconds, especially when we have a Teams call going on. It's a lot faster if you're just doing it on your own without sharing your screen. It's selected the chosen product. It'll give you the information, the phone number, the mailing address, practice locations, any websites that are affiliations. As Eddie said, PubMed articles, which are amazing. I love that it has the notable colleagues. I actually utilized this out in the field and closed a doctor based on this. It was a warm introduction. I said, hey, Dr. So-and-so actually referred me over to speak with you. I know you focus on non-small cell lung cancer. And it was a great way to really have a warm foot in the door.
And so you'll see right here. So this is an example of our checks and balances system. So if we weren't able to find 2 points of data essentially to confirm this, we're not going to report it out.
Exactly. We'd rather have nothing on the report than false data. So you have the Medicare claims data, Sunshine Act will be below that. And what sales methodology did you select for this one, Eddie?
I think I just did
Challenger again? Okay. But yeah, that's fully customizable. And if your company or you specifically want a methodology that's not on there, we could add it in an afternoon. We just had a client that requested integrity selling before, and we're adding that. And then we just added feature benefit value selling for one of our customers, the Medical Sales College. So we also have just additional Teams features that we're working on. As Eddie said, we're going to, in about 3 months, we'll have the AI chatbot for role playing. But we're also going to be having a new dashboard that we're releasing. So this will be showing your existing doctors. You're going to have a 30, 60, 90-day pipeline. And then eventually, which is the last thing on our list, but it's about 6 months out, we're going to be integrating with a recording site where you could record your calls in real time on your phone, and it'll actually provide feedback. It'll actually can integrate too with Salesforce, where it can log your calls automatically, so you don't need to manually do that. So our overall goal is to increase the efficiency of sales reps, have them spending more time selling and being out in the field to be able to be more effective with their job, save time with the pre-call planning, with the call logging, and really free them up to do what they do best and close business.
And what we've noticed with this industry as well, right, is that a lot of these companies they're spending an astronomical amount of money on data, right? Definitive health data is very expensive, but at the end of the day, all it is a list of leads, right? Somebody still has to go sell those leads, and so that's where we focus our time and energy, right? We're focusing our time and energy on what are you going to say when you're standing in front of that doctor? What warm talking points are you going to have? And so we realized, like, if we made this easy to get the data, reps are going to use it, right? We're all very busy, and this is a very hard job. And so putting it into this, easy to use software, mobile friendly in the field, you guys are more likely to use it. And so that's why we developed it this way.
Yep. And so we're able to onboard full teams in a very quick amount of time. We're always available to demo. Our pricing is amazing. And so what we average for teams, so of two or more people, it's $500 per rep per year. And so that is pretty incredible, given our competitors are astronomically more expensive than that. If you just want an account just for you, it's $100 per month or $1,000 per year. And so if you guys would like more personalized demos, please reach out to Eddie or I. Eddie's email is right here, Eddie@RepPrep.ai. Mine is Brandon@RepPrep.ai. And please, we'll put our contact information too. We'll send out an email, but reach out to us, LinkedIn, our social media, anything that you need. We're happy to help and work out with you. We currently have a free 7-day trial, no credit card needed for you guys to get your hands on it and test it out. And if you guys have anybody that you'd like us to present to, please let us know, and we can work out a full-scale trial. So I'm going to be monitoring the chat right now to see if there's any additional questions. Eddie, do you have any closing remarks?
No, I mean, again, this is made by reps for reps. So we wanted to create something that we would actually use. And as somebody that has been using this, I'm full-time now, but I was using it up until like 6 months ago, and it is very effective. It definitely takes away from that like robotic feel of going in and doing the same elevator pitch every time. I felt like I had more control over what I was saying and how I was presenting my information. And it is very effective. We'd love you guys to use it. And yeah, thank you so much.
Guys, this is incredible. As a rep, I can just think back to the ortho days and having a team and some of the shared notes and being able to pull up that information. And I think it's just so incredible. And having all of this in one place. It's interesting, part of the lobby and the why I built the company is because it was things I needed. And I hear you guys saying the same thing. It's like, we wanted this, we needed this, so we built it. So, just kudos to you guys for going out, putting the time, the energy. I know how hard and difficult this must have been to pull all this together. But you guys have built an incredible product. I know that's going to help a lot of reps. So thank you so much for your time and what you've built in this platform.
Thank you. I mean, so actually one thing we didn't go over was the add product section. Did we, Brandon?
No, but so there was just a question I was responding to in the chat, so that'd be great for us to be able to talk on. So we have all the competitor information. We scrape that data. We have it already. It's in the internet and it's in our system. But when you're creating your account, you want to go and add your own products. That's how you get your specific company information. That's how it tailors this sales plan to specifically your company and to your products. So at the beginning, when you're on a team, there's only one person that needs to do this. Typically, it's marketing team. If you have a personal account, you do this on your own. You copy and paste from the website. You could drag and drop your marketing material, and it'll populate your product information for you. Some companies like pharma have a lot of red tape where they want a specific talk track. We could absolutely customize it and hard code it so it doesn't deviate from what you as a manager or a company would like to see your reps saying. Thank you, Ty. Thank you, Shauna. Thank you, Kim. Yeah, please feel free. I'm putting my email and Eddie's email in the chat. Please reach out to us directly if you would like to personalize demo. Because Kendi's been so amazing, we'll offer anybody from the lobby a 30-day free trial as well to be able to fully utilize that. And so we really appreciate the partnership, and we look forward to working with all you guys closely.
Guys, I love it. Thank you so much for doing that. Anybody listening, reach out to them. Take the next step, try it out. Use it for 30 days. I think you can find yourself, for that price, you convert one customer, and real quickly you paid for it for a long time. So this is an incredible tool, and thank you for sharing it with our community today.
Perfect. Thank you so much, Kendi.
So much.
All right, thank you guys. Everybody have a good one.
Take care.